Hello, everyone. Thank you so much for joining us today for our webinar on workplace mental health in the new normal. Just a few housekeeping items to start off with. Everyone is on mute and your cameras are off so that you're able to focus on our speakers today. We will be sending out a recording of today's webinar to everyone in a follow-up email next week. So just look out for that in your inbox, as well as any useful resources that our speakers might be mentioning today. At the end of each of our 3 sessions today, we are going to give you an opportunity to pose any questions to our speakers as well. So please feel free to use the Q&A box at the bottom of your screen to submit any questions that you might have as we're going through the sessions. Now, today's topic is, of course, a very important and timely one. Essentially, how do we go about supporting workplace mental health when we're all adjusting to this quote unquote new normal, whether you're working from home or going back to the office or entering a hybrid situation. We're all in certainly a state of flux right now. Over the course of the pandemic, of course, we've seen a lot of worsening symptoms of mental health as well as substance use, whether that's in our colleagues, in our employees, or in ourselves even. So, and it's certainly no surprise because like I mentioned, we're all dealing with a lot of uncertainty and a lot of added pressures from different sources, including work. So I'm very pleased today to present to you a wonderful panel of speakers who are going to help us dive into some of these challenges that we're all facing and explore some of the possible solutions. So without further ado, I'd like to introduce our panel. First, we've got Dr. Georgia Pomaki, who is the leader of mental health specialists in wellness, disability, and life at Manulife. She is a clinical psychologist by training, also has a PhD in workplace mental health, and is a certified disability management professional. Her focus is on management of mental health disability claims, mental health prevention, and building stronger organizations. We also have Rosalie Croteau, who is a senior consultant in health and productivity at Hub International. She is an expert in disability management, organizational health, and productivity, and she is also a thought leader in workplace wellness. And then our third panelist is Dave Phillips, who is the Chief Mental Health Officer at TeksMed. He has a graduate degree in counseling psychology and has over 30 years of experience in the mental health field, including working with companies across multiple industries to care for the well-being and psychological safety of their workforce. So welcome, Georgia, Rosalie, and Dave. And if you're okay with that, we'll jump right into a couple of questions that we're hoping to get through and answer today. And Georgia, if you don't mind, I'll start with you. So just in your role at Manulife and dealing with disability claims and sort of preventive measures, what type of trends have you been noticing related to mental health and addiction, and particularly on the background of this pandemic?
Yeah, thank you. It's great to be here today and talking about this very important topic, as you just mentioned, Sue-Ann. So we have been seeing an increase in our mental health disability claims year over year for the past few years, and actually 2020 and 2021 were no exception to that. We're also starting to see an uptick in disability claims from younger cohorts, say this 26 to 35-year-olds, as a proportion of the total in all our disability benefit lines. So that's another concern. It is also consistent with results from a lot of national surveys that report adults being one of the groups that are most affected by the pandemic of mental health. And in particular, just diving more into the kinds of claims that we see, really an increase in our depression and anxiety claims going up. So again, this really, the barometer of all the national surveys we've seen come out, with levels of anxiety showing to be 5 times higher compared to pre-pandemic, and 1 in 5 Canadian employees reporting experiencing depression. And in fact, one of the latest polls that I've seen come out showing that those rates of depression are still rising in Canadian workers. So we really haven't seen kind of the decrease starting at all yet. So those are kind of some of the basic trends from our disability claims.
Oh, thank you for the insight. And I guess, like Dave, from the TeksMed point of view, have you been seeing similar types of trends as well?
Yeah, thanks. I really appreciate George's perspective on that. And I think the perspective that I bring to this, Sue-Ann, and to and everyone here, is less from the occupational disability context and more, on a personal level, trying to help our organization, other organizations find ways to help. But I fully agree with what George has just said, that we're seeing a significant increase on every measure. Right, and maybe to put a little shoe leather to it, as one of the hats I wear is I'm a supervising professional supervising therapist for about 60 therapists here in the Fraser Valley, and I would say 4 years ago, if a therapist was starting practice, they would say, "How long is it going to take me to get a reasonably full client load so that I'm making ends meet and whatnot?" That's just sort of like a way of understanding kind of how significant the mental health issues are for people. And normally we'd say 6 to 8 months that it takes to kind of get a full client load. And now we're looking, if a therapist now puts a shingle out, it's going to take 1 month for them to fill their client load. And that is since COVID, right? That is absolutely the variable here is COVID. And even though that we do see kind of a shift, we all know this in COVID from, we're getting a better handle on things from a societal perspective. We absolutely, just as Georgia said, we are not seeing any decline in the mental health rates of anything. They seem to be getting worse. And, it's really important that we try to understand this phenomena from a mental health point of view in terms of how organizations can or cannot support their employees and with different measures. Yeah.
Yeah, and similarly, Rosalie, is that what you've been seeing as well? And have you started to see any changes among employers in reacting to these types of trends?
Yeah, absolutely. And I totally agree with Georgia and Dave on what we have seen. And it's funny enough, if we go back in the first wave of COVID, we kind of saw a decrease in the number of short-term disability claims and even employee assistance program utilization. And we saw that slower intake and increase as we went along. And now we're seeing and hearing from a lot of employers and organizations about rising costs for long-term disability and overall benefits as well, because the environment has changed. The Canadian mental health has worsened as well, according to a few surveys. And to name one, the Leisure Marketing has provided that as well. One tidbit as well, in Quebec, I know most of our network today is across Canada, but more specifically in Quebec, the RAMQ, so the medical insurance, the public medical insurance, has released some data with regards of antidepressant prescription, and it has increased twice as much over 2020 as it had in the past 15 years. So this is to add about the mental health and what we're seeing and what Georgia and Dave are seeing in the disability claims, that mental health was the number one cause, the number one cost for disability as well, and it still is today. And I think the employers are even more attuned to those topics, and it opened their eyes and open a little bit more conversations about the total health strategies and wellness as well in the workplace.
And I guess just to maybe expand on that a little bit, Rosalie, have you, you said it's making employers very much aware of some of these trends they're seeing it affect their employees, worsening mental health and substance use. Have you seen any ways that employers have been really positively responding to these types of trends?
Absolutely.
Yeah.
Yeah, absolutely. I mean, employers have been very creative in reacting. Obviously, there's always the ones that were ready, that have started the wellness journey, and some of them it's fairly new to them. But we're seeing that trend in terms of providing additional support. So to name a few, obviously telemedicine, virtual and online support has been something that has evolved very, very quickly, that has been in demand as well. We're still seeing some employers that want to add those benefits or try to add more virtual supports. I've also heard some conversations and seen some employers increase the coverage for mental health as well, which is phenomenal. We typically saw some very low coverage around 300 to 500, which we well know the one-on-one type of support for mental health in person is much higher than that. There's definitely some additional support that exists now with virtual that decrease the cost for employees and employers, but definitely saw additional either coverage, or we even have one client that decided to remove a maximum completely for the mental health support to ensure that everybody gets the support that they need. It's not for everyone, obviously, but this is one of the trend that we've seen. Employers are realizing that they have to go beyond just treatment options as well. They can go beyond that by offering a very healthy and well-being in terms of the environment at the workplace to prevent those disabilities and to prevent those mental health disabilities to increase and go beyond the previous symptoms, the initial symptoms.
And Georgia, have you been seeing similar types of actions taken by employers to prevent, to take preventive measures?
Absolutely. This is actually something that was very clear right from the beginning of the pandemic. We have received actually an increased number of requests for stay at work services, which is really great. Seeing that employers trying to assist with keeping employees who may be struggling with mental health issues, keeping them at work, but putting in place simple accommodations and a variety of accommodations that we have been proposing and working with employers with, flexible schedules, for example, staggering work hours, working from home, sometimes changing slightly work tasks, or providing additional protective equipment and other supports because there's an increased sense of risk, right, for COVID, and that could actually trigger pre-existing mental health conditions and anxieties around that. So definitely, that is definitely something that we saw, and it's a very positive trend that we hope to continue to see. Another trend that we're seeing is really in the area of manager leader mental health training. So we've seen some of the 2021 surveys out of the business group of health that more and more employers, about 65% of employers that they surveyed offered manager mental health training, compared to 30% back in 2019. So really the percentage has doubled. And with a manager better trained to speak about mental health, this can really reduce the stigma to disclose when a team member is struggling, and also offers an opportunity to provide resources both at work and also health related to really stay strong. So anti-stigma campaigns, also the same survey showed that went from 18% of employers wanting to do them in 2019 to 50% in 2021. So this is a positive trend. So good progress. However, our own wellness report study showed that 61% of employees still are not feeling comfortable to discuss their mental health with their manager. So a lot of progress has been made, a lot of positive trends and responses, but still this needs to continue to be a focus because there's still way too many people being afraid to discuss mental health like they discuss physical health.
Sure. And I guess in the work that you've been doing, Dave, as well, have you been encountering this as a big problem, like the stigma around discussing and disclosing the struggles that you're having as an employee?
Absolutely. I mean, what I hear most from employers is kind of like a desperation. And it's most employers that I connect with, they care about their employees. They want to do something. But as I really appreciate what our other speakers are kind of laying out here is we really do have kind of this triage space, which most of HR are very familiar with. We have someone's on disability, how to support them. I really appreciate us trying to step back and say, can we put more money into actual numbers of sessions for folks? But that kind of occupational disability space is fairly well defined. We're trying to do our best, but I think there's some low hanging fruit for us as well. So I think what our other speakers have said, I think manager training would be like number 2 on my poll as being really, really important. And I think it's not just that managers are finding a way to actually speak to their teams and the folks that they work with about mental health. That obviously is really, really important, but they deal with their own mental health. So, I mean, as a clinician on any disorder, let's say we take PTSD. PTSD is a clinical line that we draw on a phenomenology, a list of symptoms that we might look at. And certainly some people are what we would call clinically PTSD, but there's a large group of people who may not cross that clinical threshold, who are still struggling, still in a very, very difficult space, and they don't get identified that early. And so these people, whether it be depression or PTSD or addictions or whatever the mental health issue we're looking at, are oftentimes in supervisory roles. They're leading teams of people, and we need to be able to help them stay calm inside. Right? When you're leading people from a position of fight or flight, where you're really anxious, you've got a lot of anger going on, you are really going to be putting your employees into a very, very difficult situation. So I really agree with if we can begin saying, hey, how can we support our supervisors, our leaders, our floor managers, these kinds of people, if we can really build in a psychoeducational way their own mental health, I think we can really make some progress on the overall health of the workplace. And the last piece is, I could talk about this all day, but beginning to shift our focus away from a pathological, treating disease, treating disorders. Again, that's very, very important. To begin this to more of a resilience point of view. So we're going to be talking about how we can help not just employees become more resilient, so that they don't kind of buckle under the pressure of anxiety, that they don't buckle under the pressure of division and anger and polarities that we're seeing in society, but they can stand firm, still be strong in their lives, in their work. And I think we can help organizations do that too. There's ways that we can say, very quick ways, because I know there's folks listening today saying, well, how could I get doing something right away? And as I look at that, there are ways that we can help companies, organizations begin to start new practices that aren't pathological. They're not even necessarily mental health branded, but they're just practices that we can be involved in. For instance, one of this comes out of University of California, Berkeley. Their research shows that gratitude at work is just little exercises, little practices that employees can do to begin just cultivating more gratitude, brings such balance to the brain. And the brain can manage anxiety so much better when it's got some gratitude going on. So that's an example, I think, of yes, we need to continue to strengthen our systems, strengthen our programs to support employees who are on disability. But I think, in the long run, we really want to create workplaces that prevent people from going on disability in the first place.
For sure. So, yeah, it's very much of a very holistic perspective on the problem, not just providing solutions, but every day.
Yeah, well, I do think that is where you're going to find, I think, again, HR managers and personnel are struggling. They don't really know what to do. They're trying to help their employees. But I really think having a balanced approach between not just, like I say, a pathological or looking at, conditions from a disease or disorder point of view, but strengthening, the resilience. A question I would have for Rosalie and Georgia is, in my, again, therapeutic experience, we are seeing that the 22 to 35 age range seems to be particularly vulnerable right now. And I'm curious if that's being backed by statistics and surveys that we're noticing, and asking ourselves, how can we particularly support that demographic?
Yeah, that is definitely something that we see both in all of the national surveys, and both for mental health issues and addiction issues as well, and also we're seeing the mental health disability claims coming in higher for that population. So that's something that we are looking at very closely, and also looking at very closely at how we can specifically support what are the needs of this particular group of employees who are struggling. These are our current and our future employees for many, many years. These are the strengths. These people are the strength of organizations for many, many decades to come. So it is a group of employees that is worth all of the unnecessary investment, and it will differ obviously per industry, because of different needs that, say, a construction company might require in terms of benefits or supports versus a healthcare, say, organization. And just to touch a little bit on the healthcare, because this is another group of employees where we really see significant vulnerability and of course a lot of pressures that are they're under in the current environment of the pandemic. So it's a significant population that requires a different kind of assistance from employers. I think the virtual health has been a great solution for healthcare workers because of the different schedules and shift work. But I think also another solution, I think, that has been very helpful and see work really miracles with this population is peer support. So in a situation, in almost a war zone kind of situation that a lot of our frontline healthcare workers are dealing with, having the peer support and having the ability to reach out to your peers who are undergoing the same pressures and can really understand you and sort out solutions, and even give that gratitude moment, or maybe moments of humor, that we can actually all depend on, to build resilience. You'll be surprised how people find humor in the most dire circumstances and are able to support each other that way, or just simply finding solutions together to problems that they have. It's been really, really wonderful to just see that happening in healthcare.
Sure, yeah. So I guess knowing what supports make sense for whether it's a different age group or different careers and industries, it's kind of all has to be tailored to what your needs are. When we come to kind of employers looking at what kind of supports they can provide, have you not to point anyone out, but more kind of learnings. Have you seen any mistakes, any missteps, or ways in which employers have not been able to balance those supports well in terms of what they can afford to provide versus what their employees really need?
Yeah, maybe I can touch upon that. And my apologies, my connection was bad and I got kicked out and I'm back now. So I missed a bit of the conversation, but to piggyback a little bit on what we were saying, I think what I love about the new generation, the new workforce coming in, and it happened in the past, but it does happen now, is that it's pushing the organizations to do things differently, to get better. And what we're seeing is that they're asking for diversity, equity, and inclusion, as well as corporate social responsibility to be weaved into the wellness programs. And I think this is where employers and organizations are sometimes struggling or have opportunities to get things all aligned. Oftentimes, one mistake that I see and that I highly encourage to take a look at it from a different perspective is to do an initiative to tick a box. We've provided a new initiatives or a new support for mental health, boxes ticked. And unfortunately, those who know Peter Drucker, if you don't measure something, if you don't track it, you can't measure it. And sometimes employers do not weave that into their total health strategy, or again, that corporate social responsibility, or even that diversity, equity, and inclusion that is extremely important right now in all organizations. So I think they need to keep that in mind, to integrate and tie it into something that is longer term. It's great to do something short term because we needed to pivot very quickly because of the pandemic. Not only that generation required that flexibility, individualization, personalizations of treatment, but also, as Georgia said, that a group support and peer support, but now everybody needed something different, that new flexibility, new work arrangement, know how their employers are going to support them. And again, tying it into that strategy, that longer term, a recent study by Deloitte showed that a total health strategy or mental health strategy can take 3 to 5 years to have a return on investment. So it's not something that will quickly happen overnight, but it's something that needs to be built upon, that needs to be reflected, that needs to have a target. So I don't know if Dave and Georgia are seeing the same thing, but those are the things that I've noticed. And I hope that those discussions that we're having will really bring that to light and help employers put those into motions towards that bigger goal.
Yeah, I guess the part that really strikes me in all we're saying, and this is coming up in the just watching the chat as we're going along, Rosalie as well. It's just amazing to me that if with so much focus now being on mental health, since the pandemic started, it's unquestionable. We are all recognizing, yes, mental health is just such a key piece of life, even beyond the workplace. Why is there still so much stigma? Why are we having still so much challenge talking about this in a way that people don't have to feel embarrassed? And this still, to me, when the question is asked, Sue-Ann, like, what are the obstacles that are in front of us? This, to me, shockingly, is still the number one issue. Why are we having a challenge being open to talk about mental health issues when, the stats that we talked about earlier, 1 in 5 Canadian employees are either on disability for depression or very close to being on disability for depression. Well, you extrapolate that number, that probably means half of us are having significant mood challenges, and yet we still have a hard time talking about it. And so that to me, if you wanting to say, what are the ways that what are the obstacles we have to address right away? That to me is the most significant one. And again, even in our conference here today, we're trying to find ways to talk about it. But am I talking about my mental health issues? Am I finding a way to give language and opportunities for conversation in the workplace about what's going on with me? That's very hard. I'm not trying to suggest there's simplistic answers, but that to me is the one that strikes me right off, is that we've got to find ways for us to just talk together, which is something, by the way, we're having a hard time doing about most issues right now, but certainly about mental health.
Definitely, I would say a cultural change is in the making. Still a way to go, but that's I agree with Rosalie and Dave on that. Changing the culture is obviously the starting mode. But how do you do that? It's not a switch, right? Like, it's more of a dimmer function, right? So it's like constantly kind of upping kind of the actions and the conversations and the dialogue. I think one of the things that I've seen work really well in organizations is being able to have an honest assessment of the needs of your employees. So being able to give voice to employees, to show and really demonstrate what are the issues that they're dealing with, what are their priorities, what matters to them, and not assuming their needs and defining your supports and benefits based on kind of your assumptions as an employer, but mostly really being able to year after year kind of track and really understand what are my employees dealing with. It will be different for different workforce. It will be very different for an organization where we really rely on a lot of younger people working and others that rely more on mature workers and different types of industries. And so I think that really matters. You can do this in many different ways. You can create health risk assessments for employees to show you kind of what are their health needs, or different types of surveys, and really understand what is it that my employees are dealing with. I find that in one area of mismatch is we see that often is we see an organization that has a high percentage of mental health disability claims, for example. They could be over 30% easily. And then you look at the coverage they provide for mental health services, and it's much lower, let's say, than other non-mental health services that they cover. So many employers will offer something like, $500 per year for mental health service, and that, or only cover a particular class of mental health professional, like, for example, only a psychologist. So that covers like, 2 or 3 sessions on average. Somebody who's struggling with depression, or even just struggling with just stress and, everyday stresses, will need a lot more than that to really make a difference in their mental health from a prevention perspective, or from a recovery perspective. So I think one of the things that we need to think about is removing those barriers to accessing that kind of care on an ongoing basis when people need it to go through their daily lives, but also when they are ill, and that happens too. The mental disorders are illnesses, they happen. And so removing those barriers, whether it's so that people can reach out for help without any hesitation, without thinking about whether they can afford it, without thinking about how can I access it? Is I can't see somebody face to face. I can only see this type of professional. So I think that flexibility is important, but it comes from knowing your people, right? Knowing their needs. That's really has to drive it, and that's one way to impact culture as well, because you're taking the first step, which is understanding, and then actioning.
I think it's yeah, really kind of apt that you've mentioned the fact that sometimes benefits don't cover what employees are needing, or they're only covering a particular type of service or just a type of professional, when there's so many other possible mental health professionals that someone could turn to that could be providing a lot of help and support. In terms of kind of reviewing coverage or benefits that an employer is providing, how have you seen organizations sort of go about that? Because obviously a lot of the other sort of non-mental health measures certainly can be supportive as well. So how are organizations balancing that to be able to provide more in the mental health support realm without sacrificing some of the other things that employees value as well?
Just to quickly touch on that, I think one of the things that I see, especially smaller organizations, struggle with is exactly that, is that balance. I think our corporate organizations and bigger clients, they have more tools in their toolbox, but smaller organizations, it's a different challenge for them. So to be able to make those decisions and make it a little bit easier for them to offer something significant, something meaningful to their employees, I think the access to virtual and digital services is really sometimes their only solution, right? So compared to not being able to offer anything, because it's more cost effective for a lot of businesses to invest in virtual mental health care. Admittedly, it's not going to be for everybody, right? So, but we're seeing more and more people accessing. And when the pandemic hit us, if it wasn't for virtual and telephonic and digital access to psychotherapy and psychiatry and family medicine or nurse practitioners or other services for mental health support, I don't know what we would have done. So so many people needed care and needed to continue their care. And that was really the only way that we could really provide it at the beginning of the pandemic. Now there's more options, but I think that's definitely something that employers can invest in, and they know that it can help them to kind of balance their priorities from a cost perspective.
Oh, great. And I know, Rosalie, you mentioned a lot about kind of virtual options coming up now that have been excellent for employers to utilize as well. Have you found pickup to be of virtual programs increased as well, especially since the pandemic? And has it been effective? Have people found it useful?
Absolutely. So obviously over the past 18 months, all the virtual support online has increased and evolved so quickly. The uptake has been very good, a positive response. I think people needed to have that continuity of care, not only to have the proper diagnosis in the right time, but also the right treatment to facilitate their recovery and their return to work. So I think it's still early to assess the full outcomes, but I think it's there to stay, and we're going to see more and more technology-based type of support that will emerge. which is great from an individual perspective. From a group perspective, I think it is needed, and all options will cater to different individuals with different type of diagnosis, or different type of challenges. One thing that is important for me to keep in mind when I talk to different employers, and I have this opportunity to speak with different employers from different size all across Canada, is to have that holistic view. So when we talk about cost control, it's important not only to think about mental health, but holistically, what can you do? While also thinking about what priorities do you have. So if your priorities is mental health at first, then one of the conversation you can have with your consultant or to have with your benefit provider is how to potentially increase a little bit that coverage. Or if you want to go in the prevention side, then what can you do to support your managers? More and more we hear from employees that their managers need more training to have those meaningful conversation and being good connectors about what resources will be meaningful for them. So this is another way that employers can control their costs by preventing those disabilities or those mental health or even those physical challenges that can occur to them. And again, that can be done virtually. It has been proven to work over the past 18 months. It can be done in person, obviously, with the different regulations that are in place from a health perspective. And there are some really, really good standards out there and frameworks that employers can follow, like the National Standard of Canada for Psychological Health and Safety is a very good framework for employer to look at and to have some inspiration and ideas from there.
Yeah, and just if I can just follow up on what Rosalie said again, when I look at what I'm looking at it from a disability management company, right? We try to return folks that are in disability in a timely fashion so that they're productive at work, they're back in the flow, but. And as we look at, what are we offering our employees? Yes, I mean, I love that we are increasing our virtual capacity, that we're trying to, go beyond. I love what Georgia said, that we, $500 a year primarily given to a psychologist is great, but it's probably not going to really meet the larger needs of the folks in that pool. So we have to be creative, try to continue to do that. Put all that together. And again, we're still talking about the folks who are on disability. And even then, ask ourselves the question, how many of us are going to go to a therapist? How many of us are actually going to do it? And we know what the numbers are there. I still think we need to focus our attention on preventative kind of measures so that these at-risk employees who aren't currently, on disability, how can we keep them from going on disability? How can we support them, right? How can we support the emotional intelligence of supervisors? How can we help organizations from the very top deal with stigma? Still, I think that is where we're going to, I have no doubt in the next 10 years, that's where we're going to see is going to be the shift away from, a hardcore disability management, doctrine and perspective, however important it is. I'm not trying to diminish it, but to say if we really want to make, shifts on mental health in Canada, that I think the workplace holds so much promise to support individuals strengthening, building more resilience, more kindness, more engagement at work. That to me is where we can see it. And I do see that, by the way, in companies. There's, the kinds of questions we get asked are like, okay, how can you help us as an organization, with stigma, with flexibility, with different kind of frameworks that'll help our employees be more productive and happier at work. So there's lots of encouraging things, but again, if we're only going to keep our perspective on, how can we get these employees to the doctor? How can we get these employees to the therapist? Well, however important it is, it's really going to be on helping, this large group of folks who are at risk, but not currently on disability.
Last point I want to make on the virtual access is we were really wondering how access to virtual psychotherapy and getting virtual psychotherapy in the disability management area, how that would work out. And we actually did a study on that at Manulife. And so when we looked at, we worked with MindBeacon specifically, and we offered to the right people, of course, access to digital therapist-assisted cognitive behavioral therapy for individuals who were off work for mental health issues. And we found that those that accessed the program compared to a control group that had other kinds of treatment actually we found a 17% reduction in the duration of their absence, which means they got better faster. That's why they were able to return to work. They got better faster, they got stronger faster. In fact, when they accessed the program within the first 6 weeks of that absence, their reduction was 37% in the duration of their absence. So it is not just about getting the care, it's also getting it early, getting it in time, and the encouragement to reach out, because this is really what we try to do. And we were skeptical going in because we weren't sure whether the research about effectiveness of this therapy that we see in general studies would actually apply for our people who are off work, and we were thrilled with the results because now we have an additional tool in our toolbox. Doesn't take away anything from all the other tools. So it is, and people were thrilled with this tool. They found it very helpful. They said that it was the only option for them where they lived and the circumstances of their life. Some of them were not able to leave the home, and that was before the pandemic, right? So because of winter conditions or family situations, some were not able to have privacy in their home to really be able to have any other kind of so they were able to kind of use the digital method to actually, and it was difficult for them to be face to face with the therapist. Some of them said that it really addressed the stigma issue for them because it was much easier for them to use a digital therapy tool with a therapist, of course, in the background, rather than having to make an appointment and go into a therapist office. So it works for the right people for sure, but we were actually thrilled because it really added a significant tool, and people told us it was very valuable for them across actually a lot of different age groups too, because we thought it was going to be mostly younger people, but it was not, and across different geographies. So we were pleasantly surprised. Yeah.
I love to hear that, Georgia, and I love to hear that it was really thoughtful in terms of which population or which pieces of the journey you targeted for those individuals. Oftentimes we think about this is a digital solution or this is a solution. It's a one size fits all, which normally wouldn't work all the time. So I love to hear those success stories of helping the right individual at the right time with the right solution. Those are so meaningful and impactful.
Yeah, I'll quickly agree just as well. I'm really impressed with that. That's the kind of like a feedback that we need to hear, right? That we are seeing that these kind of cognitive behavioral interventions done in this way actually get people back to work quicker. I think that's wonderful. Thanks for that.
Yes, yeah, definitely. I think there is a little bit of skepticism in the chat that I'm seeing with virtual therapy. Sometimes it's certainly new, but it like you said, Georgia, it's opened doors to some people who haven't been able to access in-person therapy for one reason or another. So yeah, definitely meeting people where they're at and meeting their needs.
I can give you just one example. It was that one particular member who said that she couldn't get to the therapist by car because it was in the middle of the winter. That's when she was ill, and her daughter was pregnant, and she didn't want to actually put her daughter at risk by driving her to the therapist. So this was for her. The only option, it was that or no treatment. So just one example. Also individuals who have difficulty with hearing. We had a couple of people who were able to use the digital therapist assisted treatment because speaking with a therapist is much more difficult for them. So it's a lot of different situations that can go on and on about examples how this really helped, but it really opened our eyes to the needs of employees and how varied those are.
And let me just add to that, in the therapy world, there's a real push from RCC and the provincial chapters to train therapists on how to do good virtual therapy, right? It's new for us too. And, it's like, I think for any of us who present publicly, when the pandemic started, you remember how awkward Zoom felt? Like we just didn't know what we were doing, for ever being kicked out of rooms. And now we're starting to get our feet a little more firmly on the ground. These sorts of conferences are working much, much better. And therapists too are starting to figure out how to do virtual therapy in a much more effective way. And there's no question, access to virtual therapy is just so much more effective than going live. Although, I think live therapy is great. I can read the comments too. But so anyways, thanks for that, Georgia. Really good feedback.
Yeah, no, it's wonderful that you mentioned that. I know even with our own outpatient team, it's a big focus to train our therapists to know how to read cues and communicate differently online than you do in person, so you still get the same therapeutic effect. So yes, like you said, it's new territory for everyone, but everyone's putting in the effort and doing their best. I'm just keeping an eye on time. So we do have a couple of questions from the audience. And again, if anybody wants to continue to submit Q&As, we'll try to get through as many as we can. So one of the first questions is, managers often indicate that they don't have time to support an employee's mental health with the ongoing and surmounting pressures of their own workload as a manager. So how do organizations go about shifting that mindset? And yeah, maybe we'll start with you, Dave.
Sorry, couldn't get my mouse down there quick enough. Well, that's such a practical and very, very real problem. I mean, the company world, business world is not set up to be a therapy center. Let's be honest, we just don't have time to be devoting large amounts of time to helping employees through crises and whatnot. And I think I know that there is a growing sense of cynicism around some of the peer programs that we've tried to implement over the last decade or so. But we have found that when peer networks are in place and functioning, that really helps take that kind of load off the manager's desk from, again, being kind of a quasi therapist or trying to be the loosey psychiatrist in the workplace. But I'm not. This is a very significant issue for managers because they've got their own work to do. Personally, again, having regular psychoed sessions where we do macro work with employees can be helpful. But again, not everyone can seamlessly move into peer support. It's a complicated program to set up. I think we're all aware of that. But when they are there and functioning, that can make a big difference to taking some of that pressure off the manager.
Yeah, we also had a couple of comments and questions around sort of starting mini conversation groups in the workplace where they participate in discussions around mental health, kind of like safe spaces. Is that something that you've seen is common and effective?
I've seen that actually being one of the initiatives, that a simple initiative that can make a big difference. And again, it's all those things are more like symptoms rather than the root causes, right? So, but I think sometimes treating the symptoms can actually alleviate some of the pressures, and then you can actually look more at a cultural change. So I've seen organizations that are just starting to kind of dip their feet into kind of really investing more in the mental health of our employees, starting with lunch and learns. And it's not going to solve everyone's issues, obviously, or mental health problems in the workplace or anything like that. But it is such a great way to open up the conversation, and even as an employer, give the right signal that this is important to me. So I would like my employees to come together and discuss or get information or have education or learn more about themselves. There's been lunch and learns around compassion fatigue, for example, which is very important because for a lot of different kinds of occupational groups, right? Because it's, and so it is a great way to actually start having that openness around mental health, and a great signal that this is an important is one of the most important aspects of of an organization and looking after their people.
And to add to that, when I work with organizations, there are three big pieces that I recommend to have in mind. So that first one is to have the upper management, the executive commitment into any strategies, whether it's mental health or holistic approach. It's really, really important for that culture change. And again, it won't happen overnight. So give yourself some time, but it needs to live and breathe, and upper management needs to be aligned with that. That second piece is a framework. So either it's a national standard or a framework that is built around clear policies, clearer processes as well. So if you work with an insurer and internally for disability management, who's in charge of what and when? It's really important to know what belongs to whom, to alleviate those managers and allow them to have those meaningful conversations and being good connectors. And part of that framework is practices as well. So it's good to have something written. It's good to know who's supposed to do what and when, but what do you do exactly? So for example, small little initiatives that can make a big difference for employees and employers is, and I've seen that and I've heard that from organizations, is, for instance, putting some meditation breaks, prompted meditation breaks, or having in calendars digital commute. Those are very small little things that can happen, but it can make a tremendous difference when we're talking about mental health or stress management or work-life balance as well, because we've seen in the past year and a half that the work life and our personal life has been meshed kind of into one. So it's important to have those boundaries. And that third piece that is so dear to me in every framework or every work that we do with organizations is communication. So communication is not only a one time and it's done, but it's something that needs to happen over and over and over. So keep those communication going, help those managers. I love those ideas of lunch and learn. But those needs to keep on going with exchanges afterwards about ideas and how to do things, and the buy-in from the employees and managers as employees as well, their buy-in on how they want to do things and how they want to have that culture shift. So I hope that helps the folks. A little long response, but those three pieces, that communication, that framework, and upper executive management commitment is really important for successful.
Sure. No, thank you so much, Rosalie. That I think that was really great. I think wrap up in terms of sort of key takeaways from your perspective. Just noticing time, so I wanted to give both Dave and Georgia an opportunity to provide us any sort of last pieces of takeaways that you'd like to provide for the audience, or some highlight on kind of what you're doing as an organization as well, to help employers.
Yeah, I've said it a couple of times, and I love Rosalie's passion. You could hear it there, that communication is such an important piece. Well, for me, again, the piece that I want to help organizations and companies do is really say, how can we break the stigma, right? How can we find ways that we can begin understanding mental health as not a characterological issue or a weakness issue, or that this person is weird or defective or in some way a broken human being, but moving into a framework that says their mental issues, health issues, are almost certainly coming out of injury, some sort of psychological, relational, early attachment injury, and that they didn't ask for it. It's not their fault, and that they need to be responsible for their life. Yes, we need to support them, but we need to help individuals and workplaces just think differently about mental health. And so that's one last thing that I always want to leave to is that. Thanks.
Wonderful. And Georgia?
Yeah, one thing I want to say, and to leave on a positive note, is that I would say before the pandemic, we have seen a lot of employers were still in the kind of the information gathering phase of understanding mental health and what can they do about workplace mental health. A lot of conversations and a lot of and a lot of education. And I think what we have seen is a lot of those same employers with the pandemic, and since the onset of that, they started to actually go more into the implementation phase, starting to actually action a lot of the stuff that they were talking about for a long time, in many different small ways. And so I think that is a very, very positive trend. I think for anyone who is in that space, it's a great opportunity to actually press on and to really make a difference in your own workplace, working with the organizations, within the organizations where you work, and really say, we know that we are all under different pressures than we have ever been, and this is the time to really take advantage of all of that is happening, and make a real difference in our workplaces to benefit workplace mental health. And I think part of that, it has to go hand in hand with fostering diversity and ending discrimination as well in our workplaces, because I think definitely for a lot of different groups of employees, whether it's women or Indigenous people or LGBTQ plus, many more groups of employees, well-being, mental health, and ending that kind of discrimination in the workplace, it goes hand in hand. You can't have the one without the other. So that's another, I think, a momentum that has been built, and I think will continue to build on as we move through the different stages of the pandemic. Hopefully one day we won't call it a pandemic anymore. So yeah.
Yes, for sure. Hopefully we're moving in the right direction. And any final thoughts from you, Rosalie?
I just love what Dave and Georgia said, and obviously keeping that momentum and having all of those wonderful thoughts. It's now o'clock. So nobody was prepared for a global pandemic, but now we have opened so many great boxes about all the opportunities and possibilities about the wellness in the workplace. So it's now o'clock, time to take one action, measure it, and assess, and then adjust as you need.
Wonderful. And yes, that's kind of us running up against our time, but thank you so much, Georgia, Rosalie, and Dave, for joining us today, providing your insights, and really having a wonderful and open conversation about what we're seeing in the workplace around mental health and substance use. We've got a few more wonderful speakers lined up. So without further ado, I'd love to introduce you to Liz Horvath, who is the Manager of Workplace Mental Health at the Mental Health Commission of Canada. Liz has over 25 years experience working with organizations to achieve better results by keeping workers healthy, safe, and productive. Prior to joining the MHCC, Liz was the CSA group lead on the development of the National Standard of Canada on Psychological Health and Safety in the Workplace, which some of you probably remember was mentioned in our previous session. And actually now with MHCC, she helps businesses implement the strategy effectively. She's also got a background in occupational health and has expertise in health and safety management systems. So welcome, Liz. Thank you so much for joining us today.
Thank you so much, Sue-Ann, and thank you for inviting me to be part of this panel, part of this session today. And I'd like to thank all of the participants for joining us today as well. The first part of the session was just fantastic, and I echo everything that Rosalie and Dave and Georgia said, and just really very supportive of all of the concepts that they talked about, the studies that we've seen, this very similar results in the studies, and looking forward to this discussion. Thank you.
For sure, yes. We were really hoping to kind of dive into your knowledge and expertise around helping organizations set up effective strategies. So let's jump right in. Can you tell us what does it mean to have a psychologically healthy and safe workplace, and why should employers care?
Excellent question. If you look at the national standard, there is a definition of a psychologically healthy and safe workplace in there. And what it talks about is an organization that promotes psychological well-being and actively works to prevent psychological harm in reckless, negligent, and intentional ways. Now, if we put that into more common language of what we would look at as a psychologically healthy and safe organization, it is one where people feel comfortable in being able to speak up about what their challenges are. They feel that they can talk openly with their manager and their peers about the help that perhaps they need, or at least they know where to go for help if they do need help. But even more so than that, I mean, what we're talking about is a workplace that actually ensures that the way that they do business is not harming to employees' psychological health. So, you know, the way that the work is designed, the psychological demands that we put on people, the amount of involvement that people have in the decisions that affect their mental health at work. So it's really not, you know, when we look at a psychologically healthy and safe workplace, what we're seeing is an organization that supports people in being successful at their work by providing them with the resources, the tools, the skills, the equipment. And they also make sure that they're not tolerating things like incivility and harassment and bullying in the workplace. So it's a really holistic way of looking at it and making sure that we're empathizing with what workers' needs are and understanding them and meeting those needs.
Yeah, and certainly that came up in our first discussion, that it's, you know, there's so many different aspects to setting up a strategy, from offering solutions and treatment options to prevention, the small day-to-day things that organizations can do to really support their employees. So if we kind of dive into actually helping organizations set up a strong mental health strategy, what have you seen? I mean, obviously we're in a pandemic, so that could be one of the drivers, but have you seen any other motivations for organizations to really review or really set up a good strategy for themselves?
Yeah, well, some of the you know, some of what we've heard when organizations have come to us seeking help are that, you know, we want to do it for the right reasons. We care about our employees. So that's the number one thing, is that there is someone in the organization who has really realized that, you know what, if we do support employees in their success, in their needs, that it's going to be helpful for them. So that's the number one thing that we're seeing. Certainly, this pandemic has increased the awareness of what people are struggling with. And there's a lot of organizations who are just looking at it going, wow, like, we don't know what to do. We need to kind of have a plan of how we're going to provide those resources to employees or get them the help that they need. And they're seeing more and more that there's a return on investment on that. So whether it's the rise in disability costs, as we heard in the last session, whether it's that employees are really struggling and just you know, reaching out for help and saying, hey, I'm drowning here, my workload is too much, or I'm dealing with a lot in my home life and my work life, and I just can't handle it all. Or we're seeing, you know, senior people coming forward with their own stories about the struggles that they've dealt with, and realizing that, you know what, this is the right thing to do. It almost always ends up coming down to an organization implementing a workplace mental health strategy because they see it's the right thing to do and that there's a cost effectiveness involved. But overall, there's also the realization that there's risks involved in not managing psychological health and safety. And if we don't manage those risks, the costs will continue to creep up. Employee turnover will continue. We'll lose good talent in our workplaces. And certainly as things are going on, what we're hearing too is that more and more employees are looking for organizations that have a workplace mental health strategy, that have good benefits, that has a good reputation as a good place to work. So I think that's one of the drivers too, is, you know, do we want to have an organization that can say, yes, we are an excellent organization, come and work for us? It's a competitive advantage.
For sure. Yeah, no, yeah, thank you for sharing kind of some of those benefits and ROI as well on investing, because I know sometimes it's hard to see the benefits when it's not so tangible or it's not written down on paper. For sure. Um, and you did mention, it's important for organizations to have somebody who really cares, who really wants to make a difference. Who is typically that person in an organization to really spearhead a strategy or make it happen?
Excellent question. And it can be different for different organizations. I mean, we often see that it's someone in HR or people services who is the person spearheading it. Or sometimes they're the ones who have been handed the task of spearheading it. It could be the CEO of the organization who's spearheading it. But sometimes it can be, a concerned employee, someone who is, has some lived or living experience, who is stepping forward and saying, we really need this, and what can we do? So when we look at, who's the workplace mental health champion within the workplace, that's that face of mental health saying, here's the things that we are doing, and they're doing a lot of the communication. But when it comes to who's actually spearheading it, it really comes down to the executive sponsor. If we try and implement a workplace mental health strategy and we only have a champion, but we don't have sponsorship and the resources allocated, then we run into some issues, and the champion then has difficulty doing their job.
Yes, and yeah, you touched on that. How important is it to really have that direction come right from the top of an organization, from the executive level, to really drive something like this?
It is so important. I mean, not to say that, a grassroots kind of approach doesn't work, because we have seen that work as well. But because you need to have resources for successful implementation of any strategy, it's important to have that executive sponsorship. And what that really means is that, people at the executive level have to understand what it is that they're asking the organization to do. So for example, if I'm a CEO and I give it to my director of HR and say, okay, implement this strategy, and I don't put the resources needed in place, then I may be setting that person up for failure. So it's really important to understand what that journey is going to look like. And the fact that it really is a journey, it's not a destination. We're never going to be at that destination. It's always a continual improvement. But there's costs associated with implementing a strategy, whether it's a mental health strategy, an occupational health and safety strategy, a diversity and inclusion strategy, a sales strategy. There's always resources that need to be allocated in terms of people, in terms of time, in terms of budgets and funding, assets that they may need to do it. So yeah, those people at the top really need to understand what that's going to look like, so that they can take their organization from where they're at, figure out, well, what do we need to budget, and how do we need to organize these resources, and how can we best support our organization to get there?
Yeah, it's it's certainly important to have that support. So for an organization that's maybe just starting to think about their strategy, if they've got the support, they've got that executive buy-in, kind of what are the first sort of things that an organization should be thinking about to set up a strategy?
Well, they really need to be looking at, do we have the foundation to create success, to roll out that strategy in a successful way? So part of that is really sitting down with managers and supervisors, those people who are frontline, and finding out what their challenges are going to be in rolling out. So, I've been watching the chat, and I've seen some of the questions coming up, and listening to our first set of speakers there. And you know, we see that part of the issues in trying to manage psychological health and safety is that managers are often caught in the middle. You know, so we may implement, we may say, okay, well, here's this beautiful grand strategy that we're going to implement, and we expect managers and supervisors to, you know, go to the training, have the conversations, make sure that their employees go to webinars and access supports and everything. But we need to understand, well, what are managers actually dealing with in terms of the workload, in terms of their own levels of competencies and skills and their fears and what they're dealing with as well. So having those conversations, really understanding what their needs are for support and bringing that back to that executive team to say, okay, here's what we need to support the managers before we move too quickly down the road. Because what we have seen is that sometimes it can be overwhelming. It has to be part of a whole change management process, right? We don't want to overwhelm people and cause them to feel stressed by implementing a psychological health and safety management system or strategy, right? So we have to understand what their needs are too.
Sure. And I know one of the questions that came up in the previous session was exactly like you said, managers are dealing with heavy workloads themselves already, especially with the pressures of the current pandemic. How are you finding organizations able to or attempting to balance that with also, you know, adding maybe a little bit more in terms of, you know, now you have to really be aware of psychological health and safety, be supporting those who are reporting to you as well. Have you found any like positive strategies that employers have put in place?
Absolutely. I think, you know, one of the strategies that I've seen is, you know, having time for managers to get together for that peer support among themselves. Being, you know, when managers are given the time to be able to get together and talk about what their challenges are and what kinds of solutions are being used, whether it's throughout their organization or even throughout their industry or with other managers. So we're finding that that's really helpful. For example, I was recently in a meeting where we talked about, you know, manager was having difficulty trying to have a conversation with an employee who is at home, they're going off camera, they don't know how to have this conversation. Well, providing that manager with a conversation guide was really helpful. Someone else in the organization was using a conversation guide. Providing access to online tools such as, you know, the Working Mind Self-Assessment tool, which can help to articulate what they're dealing with. So providing training, providing tools, and just really creating that safe space for people to be able to talk about what their challenges are and what they're using to be able to overcome these.
Yeah, even in I think somebody had mentioned like peer support groups, so not obviously for employees, but also maybe it sounds like kind of groups that are dedicated based on sort of your level of seniority as well, where you have maybe common concerns or common challenges that you can share with each other.
Yeah.
Wonderful. Okay, and then kind of like moving down sort of deeper into developing a strategy. I know some of our previous speakers did mention, you know, it's a lot of the preventive measures up front, making sure the culture is a positive one. But we did also talk about actual tools or actual treatment programs that might complement that strategy. Have you started seeing a lot more people incorporating treatment options or even higher coverage for treatment options for their workforce?
Yeah, we've certainly heard about organizations who have increased their coverage for access to treatment programs, better access to benefits, EAP. We've also seen organizations that have brought in access to virtual treatment programs. You know, even in our own organization, we have access to dialogue, which is fantastic and highly respected and well used. We're also seeing more access to treatment options that are perhaps not available within the organization, but within the community, because not all organizations have benefits, right? So organizations are now helping to get their employees, communicate with employees about options like Wellness Together Canada, which is a free service that's available for Canadians in both official languages, and whether they're here or abroad, they have access to this this virtual program. So yeah, we are seeing more organizations looking at how can we provide access. But even before the pandemic, and we had to look at virtual, I've also seen more organizations looking at, okay, how do we connect people with treatment options to help with keeping our employees at work or bringing those employees back to work, especially in those cases where there may be a complex mental health illness, a complex mental illness, or there may be more complex issues around the workplace, such as dealing with workplace bullying or harassment or violence, or post-traumatic stress. So in those kinds of cases, it's really helpful for organizations when they do connect with a treatment provider who is able to help the employee, but also deal with the insurance company to make sure that that employee is getting access to various forms of treatment or services that might be helpful for them. But they're also liaising with the organization and the HR or People Services Department to make sure that when that employee is integrating back into the workplace, that their needs are going to be met with respect to any accommodation or any services that might be needed. And certainly, in my career, both with CSA and prior to CSA, I've seen that being really, really helpful.
Yeah, actually kind of sort of that piece of reintegrating someone back into the workplace, or even if they're doing treatment while doing part-time or still staying on their job, that seems to be a piece that I think a lot of organizations, maybe forget. They send someone off to treatment to have a program and then expect them to come back to work 100%. Is that something that you've seen as well, or that you've seen changes in employers coming around and realizing how much support, ongoing support, is still needed even after someone seeks help?
I've kind of seen it both ways. I've seen some organizations where, yeah, they just, expect, okay, you've had your time off and come on back. And that's unfortunate, but I've also seen more that are saying, okay, well, what kind of support do we need to offer? And one of the things that tends to come up in those conversations is, how do we also provide support for others in the team, others in the workplace, because they may need some education, they may need some anti-stigma education, or appropriate language education, or they may even need some support themselves to deal with the feelings that they might be having. Because what we hear sometimes is that there is, part of the stigma around mental health and around going off with a mental health mental illness, is, when I come back to the workplace, are my coworkers treating me differently? Are they resentful towards me? Are they angry towards me because they've had to take on that extra workload? So helping those managers and organizations be able to make it a safe place for the employee to either stay at work under accommodation or come back with accommodation, in dealing with, it's not just the employee who has the mental illness. This is a community, and making it part of a community so that it's a welcoming, safe atmosphere.
Sure, yeah, and yeah, very, very topical, kind of mentioning stigma. So yeah, and not just For sure, like kind of returning to work and having and knowing that you're returning to a safe environment, but I guess also on the front end, how are organizations or businesses to reduce the stigma of people coming out about their struggles in the first place? Have you found some really good strategies that people have been able to approach that?
About talking about their own struggles and what their needs are. Yeah, absolutely. I mean, I've seen some organizations that have really done a great job at creating that safe space by educating, providing training like mental health first aid and the working mind to really help people understand what stigma is and how to have those conversations and how to create those safe spaces. One of the most effective strategies that I've seen, though, is when senior leaders come forward and they talk about their own struggles and they are able to be open and transparent. And then people at various levels of the organization start to realize, I can talk about my own struggles as well. It doesn't necessarily mean that it's all mental illness. And that's part of what we see is that when we focus only on mental illness, that also can have an effect on the stigma. But when we focus on mental well-being and the fact that we are all along this continuum and we are somewhere between, being ill and injured and ill and, maybe reacting and well, that we move along this continuum at any given time. And there are things that we can do to support people. So being able to talk about it in those terms and being able to understand that, mental illness mental wellness is not an absence of illness. And it's okay to talk about what our needs are, but really helping people to be able to articulate it is a huge piece of it. And the training helps to reduce that feeling of judgmentalness that may come in where, I may be, self-stigma is a huge burden that we have to get over. So if I'm feeling like somebody's going to be judgmental towards me, then I'm not going to feel like it's okay to talk about it. But if my manager has talked about it, about the struggles that they may be feeling, if my director, if my CEO has talked about it and really, made that a safe space that I can talk about it without feeling judged, that's part of it. But then there also needs to be some follow-up to it. Because if we're just talking about it, but not taking action to address some of the systemic issues in the workplace, then often people may not want to talk about it anymore because they feel that, okay, well, I'm coming out and I'm talking about it, but nothing's changing. And so I have seen people kind of back down from talking about it as well. So that safe space is not only talking about it, but then taking some action.
Yeah, showing that you're actively listening and actually acting on it, for sure. I imagine that with organizations introducing training and different supportive measures, I imagine it probably takes a couple of times for people to really understand that message. Have you found that, is there a particular cadence where people should be doing training on a regular basis? Is it every year? Like, does that message have to continually be broadcasted across the whole organization?
I think it really depends on the culture of the organization and the psychological demands, the types of challenges that they're dealing with. But certainly, we know that refresher training is very powerful. And even with the working mind, we do provide boosters. But what it comes down to is understanding the needs of your people. So when you're putting a psychological health and safety strategy in place, one of the things that has to be included in there is a governance strategy. And that includes a communication plan. How often what are we communicating? How often are we communicating it to who are the stakeholders that need to hear these messages and receive this communication? But what's the communication feedback loop as well? Because communication is multi-directional, right?
Mm.
We also need to have a training plan, and having a training plan means that we have to have done some sort of an assessment as to what the training needs are, so that we can match those training needs so that we can match the training, the frequency, the duration, what type of training is needed, what level, who needs to have this training. That all needs to be taken into account. And then of course the documentation and providing the resources. But a big part of that too is going to come down to removing the barriers so that people can access that training. Because, you know, no matter how often we provide the communication, sometimes what we hear from some people in organizations is, I'm bombarded with information about mental health and it's affecting my mental health. So we have to make sure that that the information that we're providing is appropriate, is accurate, is timely, but that we're removing barriers so that people can participate in those programs and access the services that will be helpful for them.
Mm-hmm. For sure, yeah, it can go both ways. You can get too excited about all the things you're trying to provide, for sure. But I guess kind of along those veins, have you seen any other pitfalls or kind of missteps that organizations have taken when trying to implement a strategy, apart from, over communication sometimes?
Yeah, I think that one of the main pitfalls that I've tended to see is, rolling out a strategy. I mentioned this before, rolling out a strategy without providing the adequate resources. I keep coming back to that because it's the main thing that I see. And part of that pitfall is, you roll out the strategy, and the strategy is for managers, employees to participate in mental health programs. Mm-hmm. Sometimes the people at the top, in top management, don't participate in those programs. So there's a disconnect as to what is really needed and what is really working. And so that's one of the pitfalls that I see. And when there's that disconnect, what happens is that there's a lack of trust, because people are trying to implement things and not getting the senior leadership support that they really need to be able to be successful with implementation. So that's one of the main pitfalls. But another one of the pitfalls I see is survey fatigue. I mean, the assessments will be done to figure out, okay, what are employees' needs? We want to hear from you, and people will, quite actively provide that information back. But they need to see action within a timely manner on what they've said. So if they're continually having to fill out surveys, but they're not seeing progress, that is one of the main pitfalls, is continually assessing, but not taking it forward into good action plans. And again, that ends up coming back to senior leadership, understanding what that journey looks like and what the resources are going to be needed to make it successful. So those are the two of the things. And then, a third one is really focusing on mental health programs with a focus on people with mental illness. Now, I'm not saying that we shouldn't have those programs. We need to have those programs. They are valuable programs. It's very, very important. But if we're only focusing on mental health programs and not focusing on the systemic issues within an organization that can be addressed through, assessment of the workplace factors that are listed in the standard, things like clear leadership and expectations, growth and development, inclusion, recognition and reward, psychological job demands. psychological protection. These are all very important aspects, and we need to do proper risk assessments of those workplace factors so that then what we're putting in place, it's not just mental health programs, but it's changes to how work is done so that we are supporting the mental well-being of all of our employees, including those who live with mental illness.
Yes, yeah, very much more an all-encompassing view, and not just having a very narrow focus, for sure, which I guess it can be easy to do, because I guess that's kind of where a lot of the obvious costs are, that you can hone in on. But I guess on sort of the converse side, have you seen organizations or some really big successes that organizations have had from implementing a workplace mental health strategy or mental well-being strategy? Are there any kind of really positive stories that you could share?
Absolutely. I mean, we're working with an organization right now, for example, that has implemented a workplace mental health strategy, as well as a diversity, equity, and inclusion strategy. And, they're making great strides. People are feeling heard. They are feeling valued. They are feeling that their ability to speak out and ask for the support that they need is that they can do that. That we certainly have heard from other organizations that like we all know the Bells of the world, and organizations like that who have been actively involved in workplace mental health for quite some time. But even from the case study that we did years ago, where we followed 40 organizations that were implementing the standard, what we saw out of that was that there were improvements in productivity. There's improvements in collaboration. So there, the research studies are showing, like the Deloitte research study, for example, that followed, I think it was 10 organizations, and it showed positive ROI in 7 out of those 10 organizations. And certainly those that have implemented the standard already definitely showed a positive ROI. So what we're seeing is that organizations that do implement the standard, organizations that do take steps towards implementing a strategy, and it doesn't have to be, a huge strategy. It's just taking those steps, but there's certain things that need to be in place. Those organizations that do, they're seeing, greater loyalty. People are staying. They're seeing reductions in turnover. They're seeing reductions in conflict in the workplace. They're seeing reductions in drug utilization costs, and lots of other improvements as well.
Yeah, so and kind of along those lines as well, how, once an organization started implementing a strategy, how do they go about knowing whether it is making an impact? Is it effective, or do they need to make changes and adjust along the way?
Yeah, excellent question. And that was actually one of the things that came out of the case study, was that, if you do, the standard is a plan, do, check, act. It's a management system, right? So if you go through the planning, you get around to that check part, evaluation. Some of what we saw was that organizations got there and they said, oh, shoot, we don't know what we're measuring. So, one of the things that we recommend is, at the beginning, identify what the metrics are that you're looking to measure. And how you're going to measure those metrics. So, there has to be an evaluation system in place. It doesn't have to be complex or complicated, but you want to measure the impact on employee well-being. So things like their stress levels, their satisfaction in the workplace. So certainly employee engagement surveys can be helpful. Measuring that employee experience can be helpful, and there's tools that can be used for that. Measuring the progress of implementation. So through audit of the the psychological health and safety management system, and just seeing how much of it do we have in place, and then comparing that to the employee experience to see what impact is it making. In addition, you can be looking at things like, are we measuring grievances? Is there an impact on grievances? Are we measuring productivity? Are we measuring customer satisfaction? So there's various metrics, and it's really identifying what are those metrics and how do we connect it to the overall strategy of our business to be able to see the impact that it's having on the business, but also, that employee experience and the impact it's having on their daily lives, basically.
Oh, yeah, that's really insightful. In terms of just like learnings from what you've seen from organizations or from that study as well, do you see a future direction where workplace strategies are going, or any big gaps that you think still haven't quite been filled, and people really need to work a little bit harder to complete or to satisfy?
Mm-hmm. I think one of the things that we're seeing is that, more organizations are actually seeing this as an essential business strategy. So as, they're seeing it as a must-have rather than a nice-to-have.
Mm-hmm.
But as far as one of the biggest gaps that we're seeing, we've been hearing from quite a few people asking, what about diversity, equity, and inclusion? We're seeing a lot of issues around that in the news. We're hearing a lot about it from government, but we're, at the commission, we've actually had people having conversations with us about whether the standard will incorporate diversity, equity, and inclusion as a workplace factor to be included when you're rolling out a strategy. Now, it's already, diversity is already in the standard, the requirement for diversity, the requirement to look at, the diverse population and understand what their unique needs are, and consider the workplace factors in the ability of diverse populations to be able to stay at work or return to work. So I think that what we're going to see is more integration of those strategies around diversity, equity, and inclusion with psychological health and safety, because they are intimately connected. And but if you look at the workplace factors, I mean, they all address those issues. And I think this is going to become more and more to the forefront as we move through the pandemic, as we are trying to figure out, how do we operate a psychologically healthy and safe workplace, but also, run our business in a sustainable way as we're trying to recover from the impact of this pandemic. We're going to see more and more around how do we support our employees, whether they're working remotely, whether they're out in the field, whether it's a hybrid or they're, front of line or back in the office. That support in this new reality of the pandemic is going to really be important, and figuring out, how do we meet those needs? How do we listen to our employees about what those needs are, and then support our managers in supporting our employees? Again, it just comes right back to resource allocation.
Sure. And actually, I think that's probably actually a good segue into some of the questions that we've gotten from the audience so far. So one of them is actually related to kind of your last point about us being in a new new working environment that's could be hybrid, could be virtual, could be in the office. But the question is what about reintegration into the workforce after being virtual for so long? And how do we manage anxiety about returning to an in-person setting?
Excellent question. We have to recognize that anxiety around returning to work after being virtual for so long is real, and that a lot of people are dealing with it. One of the things that we also need to look at is the fact that it doesn't mean that we have an anxiety disorder. Now, some people do have an anxiety disorder, and we need to provide that accommodation and make sure that it's a safe space for them to return. But understanding the anxiety around returning to the workplace in a pandemic means understanding what the challenges are that people are dealing with. How do we make sure that they are, first of all, able to do that social reintegration? We've all been kind of behind the camera now for a long time. Being around other people in a pandemic, there may be a certain level of fear. So we have to deal with social stigma that may be occurring in the workplace. And we do have a good online webinar that we did with Dr. Keith Dobson from the University of Calgary, talking about social stigma in the workplace and what employers need to know. So I would recommend going and having a view of that. It's on our website. Also, making sure that employees are able to get to work in a safe way. Now, it's not the employer's responsibility how the employees get to work, but certainly understanding what their challenges are around getting to work, and even just, is it appropriate for them to be coming into work? Are there accommodations or flexibility that might be needed? So again, it comes down to having those conversations with employees about what their unique needs are in order to be able to address those. We also have a guide called Building Mental Health into Operations During a Pandemic that does talk about some of the, there's tools in there that you can use. There's conversation guides. There's certainly a lot of information about how to make sure that that you're dealing with the physical workplace and that fear of infection in the physical workplace can be one of the things that can cause increased anxiety. And then, am I taking something home to my family? So there's, I would definitely recommend downloading that guide. There's a lot of good information in there about how to deal with this.
Thank you. And yeah, I know the Mental Health Commission definitely produces a lot of really great resources. And I know you mentioned a couple of them, so we can definitely share them with the audience in our follow-up email next week. Another question that's come through, kind of more touching on a little bit of sort of the what you mentioned about inclusion and diversity, but also in the context of us being remotely working for so long. So in this digital meeting environment, I'm wondering about what are the effects on employees who are required to have their cameras on, particularly those who might feel uncomfortable, perhaps women, or those who have body dysmorphia, anxiety, or even if they have a chaotic home environment with children and pets. And does that impact their mental well-being, and what is the responsibility of the employer to accommodate?
Well, I'll start by saying I am not a psychologist, so I can't talk about the specific impact that it may have on someone's mental health. But as far as the employer's responsibility, one of the things I would say is we shouldn't necessarily require an employee to have their camera on. However, there may be certain types of things that employees may need to be involved in where you really do need to have the camera on. So for example, if I'm giving a training and I need to be able to see people in order to have that interaction, that can be very helpful for the trainer, but it can also be helpful for the employee on there. So part of what we should be doing as employers is providing perhaps even some education and training on how to be on camera and just the skills on how to do this. So for example, how to set it up, how to block your background if you need to block your background. I mean, we can do that. How to create a space that you can go to and feel okay about being on camera. But if somebody doesn't feel comfortable being on camera, I think it's really incumbent upon the manager to maybe just reach out and talk to that person about their concerns about being on camera. And it doesn't, and not in a probing way, like not violating their privacy or anything like that, but just so that they understand. Because what we also want to do is make sure that people aren't just getting into that isolated space and feeling very disconnected from the workplace, because that's not healthy either. When we're seeing each other face to face, we're able to see signs and symptoms or indicators of declining mental health. If we're not able to see people, we may miss those indicators, but at the same time, we have to be respectful of a person's privacy. So if there are ways that we can accommodate them, maybe have phone calls. We seem to have forgotten how to use the phone lately.
For sure. That little thing that sits on our table. For sure. Yeah, trying different methods. No, that's great. Another question that's come through, and I guess this is probably more specific to a particular province, but they're asking that, mental illness is increasing across the country, and particularly in Alberta, they've entered into a state of emergency. So with kind of all these things going on, and perhaps in certain places of the country where the pressures are more so than in other places, how do we deliver a balance in our well-being for organizations?
How do we deliver a balance in our organization?
Yeah, or how do we help? Maybe how do we help employees cope with sort of the fluctuating pressures of the pandemic as it keeps coming in waves, it seems.
Well, one of the things that we recommend is just really empathy, sensitivity, and flexibility. So we do have a tip sheet on goal setting during a pandemic, and one of the things that we talk about in there is, we still need to have goals, but we also should be looking at the short term. So we need to be, we're in this new reality now. We have to be, we need to look forward and understand what to expect. Management can support people with getting access to resources. Management can support people with talking about what their needs are. So if for example, a mom has to stay at home with their kids and doesn't have access to daycare, or the kids aren't able to go to school for whatever reason because perhaps there's a lack of transportation or a lack of safety at the school, or there's been an outbreak at the school. There's challenges that our employees are dealing with. So the more flexible and empathetic an employer can be in helping employees deal with those challenges, and understanding that maybe we need to make some changes to schedules, or maybe we need to make some changes to the workloads that we're asking people to do. I know that that's difficult, and it's not always possible, depending on what the type of work is, and certainly we're seeing that in certain types of workplaces. But sometimes just being able to listen and hear what people's struggles are, that can go a long way. And being able to connect them with resources that may be helpful, because we may not have the resources in our own organizations, but know what resources are available in the community that you can connect people to.
Sure. Okay, and so the last audience question, but if there is no, if they aren't able to find an executive sponsor or someone who's really able to champion a mental health strategy, are there ways to do that? Are there ways to approach that conversation, or convince somebody that that's a worthwhile cause?
I would start with the business case. You really have to gather the data of what it is costing the organization in terms of, conflict, in terms of health benefits, drug utilization costs, turnover, various aspects of the impacts of workplace mental health. So that's one part of it. We do have general information that's out there that talks about what the costs are to an organization. But you want to bring it down to how is it actually impacting our organization? But turn it around. So this is one of the biggest things that we teach organizations is turn it around into the positive. So rather than saying it's costing us this much, we look at it and say, what benefits could there be to our costs? So how can we improve our turnover rate? How can we improve productivity? What improvements will we see with respect to morale in the workplace, quality, customer service, occupational health and safety, our insurance premiums, our workers' compensation costs, attracting new employees, attracting new business. When you turn it around into those positive aspects that speak to people in senior leadership positions who hold the purse strings and make the decisions, then they're able to see the benefits of putting it in place rather than just seeing all the problems and the costs.
Yeah, no, that's I'm sure that kind of resonates in all aspects of life. People tend to respond more to the positive than the negative, for sure. Definitely. But yeah, it's just kind of one last thing is, Liz, if you've got a main takeaway or a key point that you really want the audience to remember from today.
Yes, I think that the main takeaway that I would say is no matter what approach you're taking to it, recognize that what we're talking about is not, we're not talking only about people with mental illness. We're talking about creating workplaces that are psychologically healthy and safe and productive. And we're talking about supporting the success of all employees, including those people who have mental illness. So when we change that conversation to look at how do we create a really great place to work, that's what we should be focusing on. And it becomes part of how we do business. It's not a program. It's this strategy is about how we do business.
Wonderful. Thank you so much, Liz, for all your insights and your participation today. We definitely value your presence. Welcome to the last session of our special webinar today. I'm very pleased to welcome two leaders from our own organization at EHN Canada. So today we have Joe Manget, Chair and CEO of EHN Canada. His educational background is in engineering, but before he entered his career in healthcare, he was senior partner at the Boston Consulting Group. Joe is currently very involved in the healthcare space. He is co-founder and board member of Leap Center for Social Impact and the chair of the Health Sector Audit Committee for the province of Ontario, which reviews spend with the Ministries of Health and Long-Term Care. He's also currently enrolled in a part-time doctorate program at Henley Business School in the UK, in which he's exploring the clinical and economic outcomes of mental health and addictions treatment in Canada. We also have Catherine Rice, who is the Senior Director of Business Development at EHN Canada, and she has over 24 years of experience in the healthcare industry, driving commercial performance with a focus on people, strategic thinking, and positive change management. She has worked in various leadership positions with major pharmaceutical firms, including Roche, Novo Nordisk, Eli Lilly, and Janssen Ortho. So Joe and Catherine, thank you very much for joining us today. And I was always pleased to be speaking with you both.
Happy to be here.
So yeah, we'll jump kind of right into the questions, and today we're really hoping to cover a little bit about EHN Canada, where we've come from, where we're heading, and really how we're helping organizations support workplace mental health. So one of the first questions is for Joe. Can you tell us a little bit about EHN Canada, its origins, and why it's been such a passion for you?
Sure, happy to. You can hear me okay? Yeah, great. And before I start, I caught Liz's presentation. I gotta say, like, I really enjoyed it. Like, Liz is just so rational and thoughtful about how she approached the issue. Like, I actually learned a lot. I took a ton of notes, so I really appreciate that. So EHN Canada, like, I think the real question to start with is, why does a company like ours exist? Right? In Canada, healthcare should be free. Everybody should have complete, unfettered access to healthcare, and we're a private company. We act as a nonprofit, but we're officially a private company. And so when you go back and look at it, the origins are our Canada Health Act. So when the Canada Health Act was envisioned in the 60s and updated in the 80s, it was focused on physical healthcare. So we actually in Canada have pretty good physical healthcare. I'm quite proud of what we have, but mental health was not a thing back then. So we've got limited mental health resources across the country, and our quality of care varies quite a bit across the country. Wait times are awful. Like in our own facility, the one I'm in right now at Bellwood, we have probably a 4 to 5 year wait list for our OHIP beds. And that's just not acceptable in any society, but it is what it is. So why do we exist? It's because there's this gap between what the public system is able to provide and the demand in the marketplace. So companies like ours have sprung up to fill in the gap. So our vision as a company, our purpose for being is to look at this, and I and all of us have this belief that every Canadian should have access to mental health care that is accessible. By accessible, I mean you shouldn't have to wait months or years. You should be able to get treatment in days or weeks. It is affordable, which means you shouldn't have to pay for itself. A lot of our patients pay for themselves today, but we're seeing increasingly employers and governments are taking up more and more of the payment. And third, it should be excellent healthcare. Like, excellent means evidence-based medical model, and that's not the standard across the country. So that's why we exist. That's what our purpose is, and we're going to continue to execute along that. So we started with the vision of creating a national network of inpatient, outpatient treatment centers across the country. So we started with Edgewood in Nanaimo, which was nationally and probably internationally renowned for its excellence in addiction treatment. And then we added Bellwood in Toronto, and we moved Bellwood into this beautiful new facility, and we continue to expand across the country. So now we're in British Columbia, we're in Alberta. We have 2 locations in Ontario, we're in Quebec, and we're in Nova Scotia. And we're continuing to add as much as we can. And then we built a full kind of outpatient services platform alongside that. So hopefully that gives you enough background.
For sure. No, thanks very much, Joe. And then over to Catherine. Can you tell us a little bit about your role on the business development team and how you're helping with organizations who refer to us?
Sure. And thanks, Sue-Ann, for having us. And I want to also echo Joe's comments about the earlier speakers. I too took a ton of notes. I think so much is in there that'll inform some of the conversations that my team have. with the different referrents. So I head up our business development team. It's a national team. There's 6 of us across the country. And we work with the people that would refer someone into treatment for mental health or addiction. And when I say reference, or these people that would refer, that could be corporate, could be within HR, it could be occupational health nursing, it could be healthcare providers, it could be insurance, it could be disability, it could be healthcare practitioners, it could be psychiatrists, psychologists. So we work with a wide range of referents who are looking for the high quality healthcare that Joe mentioned in the mental health and addiction space. So we go out and we talk about what EHN Canada offers. We talk about our facilities. We talk about our numerous programs, and I'll get into a lot more of those later because we have some really innovative things that we're launching and continue to have. We actively go out and increase awareness about these types of programs and our facilities and this high quality care. We work with referents in supporting them to get all the information that they need to have someone brought into one of our programs. And then we do the ongoing communication back and forth, doing temperature checks on feedback, making sure that the reporting requirements are being met in terms of if it's going to a payer or if it's going to a healthcare provider. We consider ourselves part of the treatment care team. And when someone comes to us, they go back to their providers afterwards. They go back to their healthcare practitioners, and we try to make this as seamless as possible. So really proud of the work that my team does in terms of outreach and actively engaging people. And we have a lot more to do. We have a lot more awareness to raise, and the team is growing as we speak.
No, thank you very much, Catherine. Kind of our sort of next question to dive into it, and Joe mentioned our origins, how EHN Canada started, but certainly since then there are a number of other mental health and addiction treatment services that have popped up across the country. So Joe, what really sets apart EHN Canada from all the other options that people have out there?
Yeah, and I know Catherine's got some things to say on this topic too, but for the majority of patients that we deal with, which is the kind of moderate to severe patients with mental health disorders, from a referent or employer point of view, we're the only national choice. So if you've got employees across the country and you want to deal with one company, that'd be us. So some of our customers, like the Canadian Armed Forces or Veterans Affairs Canada or CMP, they actually see that value, and by all of our different treatment centers can offer slightly different levels of service, or can be geographically closer to their employees. So from that point of view, we're definitely the only provider. We're very focused, as many other mental health providers are, though. We're very focused on quality. Evidence-based treatment, but a particular pet peeve of mine is measurement of outcomes, right? So when I started in this role, okay, I'm an engineer by training, so I think everything should be measured. And Liz, in her presentation, talked a lot about how we got to prove things with business cases. So I said, okay, how do we know we're getting people better? And it's almost as if, so pretend I'm an oncologist. And I say, Sue-Ann, I heard about this operation in New Zealand, and I'm going to do it on you, and everything will be fine. And I'll do the operation. I'll say, so how are you feeling? I don't do any measurements. I don't do any tests. That's the state of mental health outcomes measurement in Canada today. Like so we look at best practices elsewhere, but we don't actually measure and monitor what we do. Now, there's some pockets of that across the country. But I'm super proud to say that we're the first ones to do what's called measurement-based care, which is measuring outcomes during treatment. So you do a check at the beginning, like a baseline at the beginning of treatment, and then every couple of weeks during treatment you actually get a baseline, and then in aftercare you get it as well. So we can actually clinically measure the performance and the improvement of the patients in our care, and that just doesn't exist. So that was actually a big aha for me. That's why I'm doing this doctorate, because I'm quite passionate about this concept of outcomes. But we don't find a peer group in Canada who does this. So I talked to I talk to everybody I can. This is the norm in the US and many other countries, but Canada doesn't seem to be measuring outcomes. So that in itself is a clear differentiator. The other thing, again, for this audience is we're very focused on back to work. So this, how do we get people clinically better, but also how do we get our patients back to work and back to productive society? So we've got multiple programs on that. So I'll pause and let Catherine jump in, but I think we're differentiated quite a bit.
Yeah, for sure. Totally agree with what Joe has mentioned here. I want to also highlight the fact that we have really expert staff with full credentials. These are master's levels clinicians. So really, I believe in the work. I believe in the education that they have and the expertise that they have. And I think that's really important when you look at this space, because as Joe said, it's outside of the public system. And what does that look like? And who do we have actually doing the high quality work? So that's a big one for me. The other piece was patient-focused care. So Joe talked a little bit about us being a network, and I want to delve into that a little bit more because I think it allows us to have conversations with employers and healthcare professionals really that is focused on the patient and what is needed in that moment. And so many of our speakers today talked about the need for options. And the fact that you come to EHN and we have a wide range of facilities across the country, each of those facilities offers something a little bit different. Yes, we have high quality programming and a lot of the time they're very similar, but there are nuances to each of those facilities in size, in the sizes of the groups, in the types of additional programming that we may or may not do, even in location and environment. Would really be conducive to really understanding what can help an individual succeed. And I think that really sets us apart because it allows us to have those conversations with you as a referent to say, what is really going to set this person up for success? And how can we make sure that they take part in a program that's really going to add value for them? So that's a big piece for us too. I'm going to spend time a bit later on talking about our outpatient programming because I think that also sets us apart. In that we have our inpatient piece, we also have this outpatient, and we've shifted it virtual and been able to really do some things differently and take the high quality programming that we have inpatient and move it to outpatient. So really interesting.
If I could add one more thing, Swen, another thing I'm incredibly proud of is our ability to innovate. As a small company, we can do things fast, like when we developed our online program, which I know we'll talk about. But we're also looking at why are people not coming to treatment. One of my favorite stories is we did some research on why are there fewer women than men in treatment, and that's across the country. And when you get right down to it, childcare is actually a big issue. So if I'm a woman with a mental health issue, there's a chance that it's also in other places in my family, and I don't want to leave my kids at home. So in our Nanaimo facility in British Columbia, we've just finished an on-site daycare, and we're launching a program which we call Mothers with Kids or Parents with Kids. But for us, it's only been mothers so far. And then most companies just don't have the freedom to innovate on things like that. So it's a great it's like we do as a small company, we can move faster and find ways to just make healthcare more accessible to more people.
Sure, wonderful. And I know, kind of looping back to your talk track around outcomes measures, I know we are actually engaging in a study right now, and we're very excited to start sharing some of those results at upcoming conferences. So if anybody in the audience is catching us at a conference, you'll definitely be able to start to see some of our published results there. But kind of turning to sort of Catherine's point around, the fact that it's a nationwide network, we have all these programs, but really EHN Canada's origins, with Edgewood, with Bellwood, we're really in addiction treatment, and that's kind of where our roots are. So how have you seen that evolve over time, and why has that changed?
Yeah, so the history of Bellwood and Edgewood is fascinating. Bellwood was started by Dr. Gordon Bell, and it dates back to the 1940s after World War II, where he was treating literally soldiers with addiction in his own home, and out of that group grew Velvet Treatment Center. But it was primarily addiction. He was one of the first practitioners of addiction treatment in North America. Similarly, Edgewood was founded over 30 years ago on principles of addiction. A lot of it was 12-step in base. And we found as time went on, when you look at the patients, when you understand what the patients are going through, it's not just addiction. Most of our patients have co-occurring mental health disorders. They've got a trauma issue, they've got an anxiety issue, depression, or eating disorder. So we found that the only way to properly treat our patients was to treat both issues concurrently. So we expanded our programming to do that. So we went from addiction to now addiction plus mental health. And then the demand was so strong for programs that don't include addiction. So at Bellwood, for example, we have a mood and anxiety program, which is depression, anxiety without addiction, and that's almost full with the wait list. So what we've seen is we've gone from an addiction only world to a addiction plus mental health world to an addiction or mental health world, and we're continuing to grow in that programs as fast as we can. But it's really based on how do we best meet the needs of our patients and deliver the best quality care. So we have to develop these custom programs.
Yeah, and kind of on expanding programs, you both, mentioned earlier that we definitely expanded our outpatient services a lot, particularly in the last year. But we've offered outpatient and online services for 10 years now. So why the investment in outpatient and online, and how has that continued to evolve? Maybe
I'm happy to start. So when you think about outpatient, there's so much hype these days about ICBT and online therapy. So that's relatively new for most people. We've been doing that kind of online therapy for over 10 years, and I'll talk about that. But our original outpatient treatment was in person, and post pandemic, which hopefully will be there soon. We're starting to plan for a return to in-person outpatient treatment, but in-person outpatient treatment was traditionally called aftercare. And when you look at the data, and I'm obviously a very data-focused person, the number one factor in preventing a relapse, whether it's OCD or addiction or depression, anxiety, is whether or not you attend the regular aftercare program. So we can do everything we can to get you in as good a shape as possible, but you're kind of in a bubble when you're in our facilities. It's really important that you continue that care. You don't need as intensive treatment, but you do need ongoing treatment. So aftercare was also a core part of what we did, and it was pretty much like 95% in person. One of the things I did when I took over as CEO is we used to charge for aftercare, and I'm of the belief that we should reduce as many barriers as we can. So now we don't charge for aftercare. It's kind of it's one package, and since then more and more people are able to engage in aftercare. So that's our kind of overall program. But it's about 12 years ago we had to develop an online platform, and that was mostly because some of our customers, and think Canadian military, for example, or are unable to come back to our locations for an in-person session. So, maybe I'm deployed somewhere. How do I actually get my regular aftercare? And sometimes they get those on their bases, but sometimes if they're deployed in a strange area, they just don't have access to the services. So we developed, I think it was Canada's first digital aftercare program. And then so we continued to invest in that, because I always had the belief that part of our job is to make mental health care more accessible. Accessible means also doing it from your home. So we developed EHN Online, which is powered by our own platform called Wagon. And we launched that well before the pandemic, but it was maybe 5% of our aftercare was done that way. And then on, I think it was March 13th, 2020, we had to flip it to 100% online. We did that without skipping a beat. We had the clinicians, we had the the capability, and that part of our company has grown dramatically. So we've obviously did aftercare, but then we launched something called an intensive outpatient program, which is an 8-week program of 9 hours of clinical therapy a week. And that was all done online, and that's just continued to grow. So we're really excited about our ability to offer online therapy. And again, but we deal with more of the mild to, or more of the moderate to the severe cases in the online therapy. But we're looking forward to return to in-person as well.
Mm-hmm. Yeah, I think, certainly a lot of people are looking forward to that mix again. But but I mean, what was covered in our previous sessions too is that the virtual options have really opened up a lot of possibilities for people, like you said, Joe, that can't access an in-person site for one reason or another, or maybe feel more comfortable in a virtual environment. I guess, Catherine, sort of turning to you, how have you seen our online programs evolving and really supporting employers in that space as well?
Yeah, really interesting. And I think the pandemic has really transformed how healthcare is provided in Canada, or across the world, frankly, where it would be you'd go sit in a waiting room, you'd travel, you'd go sit in a waiting room, you'd wait for your appointment, and then you'd have your appointment, and then you do the travel and you come back. And I think what we found is we've been able to pivot, and people use that word probably too much right now, this whole pivot. But the outpatient program really did pivot, as Joe talked about, and provided excellent care. One thing I want to add to that is what makes us, I think, different in this space is that we provide both group sessions and individual sessions as part of our outpatient programming in this virtual space. So especially the intensive outpatient, Joe mentioned the 9 hours a week that's in that. I would say 8 of those hours are actually skills building group sessions. And we know that the group work is really important for people because they see themselves in others, they can support each other, they can learn and grow. And that's something I think that makes us a little bit different from an outpatient perspective. We also have outpatient programming across the different treatment modality or the different treatment areas. So substance use disorder, mood and anxiety, workplace trauma. So we have a number of different areas that we can help support employers. Again, I go back to what the patient needs or what the employee needs. What is it that they're dealing with right now? And something really interesting, and I don't think it came up today as we were talking, and I've listened to all the speakers talk about what employees are dealing with. I didn't hear much about dependence and the stress of what employees are feeling right now. I did hear people talk about, kids and dogs and this whole world of transitioning. And, my dog's sitting here right now, and God knows at any point in time she's going to take off and start barking. But the stress and the anxiety that employees feel about their dependents and especially their kids right now. And I'm really excited because we're launching a youth intensive outpatient program on October 4th and taking the key learnings that we've got from our adult program and moving it into the teen space where it's so needed right now. If you read the press right now, it's everywhere about kids and youth specifically really struggling with anxiety and depression. And that's what we're going to be focusing on with this program. It's nine weeks of virtual therapy, 2 hours of group therapy a week and 1 hour of individual. And then it also includes 14 weeks, of aftercare, to Joe's point, to really help support teens moving forward and build better habits, recognize their own mental health and the importance of it. And most importantly, help them with developing coping mechanisms. So more to come from our team on that, because I think we can help employers help their employees with a stressful part of their life, which is their kids. Working moms and dads have really struggled over the past 18 months, and kids have struggled, and it's impacting work outcomes too. So I think you look to us, and I'll give you my contact information at the end of this, because I think we can really help employers with this program too.
Sure, and I think you bring up a really good point. Obviously, with the new teen program, but also, Joe mentioned our Parents with Kids program out at Edgewood as well, and I think certainly including the family and loved ones in treatment is a big part of kind of our EHN Canada values too. I guess, yeah, I guess, and that's also part of our outpatient services, I guess. Maybe.
Yes, and actually, a key point I missed, Sue-Ann, is the youth or the teen program does include 12 hours of caregiver support, caregiver programming, so that parents and caregivers can really help support their kids, help them understand, help be there, understand. I have a teenager myself. What should you say and what shouldn't you say? Because I can tell you that 90% of the time I feel like I'm saying the wrong thing. So what is it we can be doing to help? And I think we need to help support parents more. And I know some of the really innovative employers that I speak to, they're really concerned about this because they hear their employees saying, I can't focus on work right now. My kids are really struggling, or I need to take some time off because my kids are having a really hard time. So we're really proud of this program and what it's going to help, who it's going to help, because these kids need it.
For sure. And now kind of like looping back around to sort of how we're supporting organizations in the workplace, particularly with our outpatient and our online program. So a lot of studies do show that staying productive at work and being at work, even while you're getting treatment or even being able to look forward to that after treatment can really help with recovery and having that support system in place. Is that something that our programs are able to accommodate and to help employers with?
Definitely. Absolutely, they are. I think there's a lot that we can be supporting employers with moving forward. And my team in particular can help them. I heard a lot today talking about, policy and going to senior leadership and making sure that you have the business case and the data. Our team can help you with that. We've got tools and resources that can help you build the case for that ROI discussion on why this matters and why mental health is important. I think we can really be a source of great resources for people.
Mm-hmm. Sure. And we did have just a question pop up just about our teen program. It's asking what ages that program will be serving.
14 to 18, grades 9 through 12.
Mm-hmm. Thank you. All right, and kind of like moving on into the next question, and just trying to kind of give the audience a little bit of insight into experience into our programs. And I know, Joe, at Bellwood, you're very you're very close to the operations, and you often actually go on hikes with our patients to really learn about their struggles and what's brought them to our facility. Has there been any stories that have really stuck with you and really sort of shown how we're able to support people in recovery and really get them back to a place where they're feeling better?
And I'm going to try and do it without crying, because I usually cry. But the reason we're able to do hikes is because all of our facilities are on lovely pieces of property. So the Bellwood site's on the Sunnybrook Park system, and I've always enjoyed kind of taking patients out for walks, and we can easily in an hour do a 5 or 7 kilometer hike. And I really upped them when the pandemic started, because so in March of 2020, all of our frontline workers, like they were exhausted, like they're the counselors, their physical therapy folks, and the least I could do was kind of help with a couple hours a day of taking patients out of hikes and kind of freeing up a gap in the window. So I started taking patients out of hikes, but there's a couple of things that stick in my head. One was, this one was pre-pandemic, but there's a guy, I think mid-40s, and he said, Joe, I'm just so grateful for everything that has happened. And he paid for himself to come here, but his wife literally dropped him off at our front door and said, I never want to see you again. Like, this is it. I never want to see you. And this is the one where I started to cry. And then we have graduation ceremonies for all of our patients. And, they talk about what learnings they had. They've got some, They've always got some jokes and stuff to tell. But for this one, his wife and kids showed up, right? Which I just thought was incredible. So that really sticks with me because it just shows you how you can do that transformation over a 7 week period. But more relevant for this group was when I think it was like April or May, and I was on a hike. I remember it was snowy, and there's a guy who worked at a relatively low paid job for a big box employer. And he said, they didn't have to send me here, but they did. And I am so loyal to my employer now because, this guy was an hourly wage employee. He might've been making like, $20, $25 an hour. And he reported to HR that he had an addiction issue, and they said, okay, we've got your back. And very few employers in Canada do that, right? Like, we got your back. We're actually going to send you the belt.